Local programming on KRWG Public Media made possible in part by viewers like you. Thank you.
Hello and welcome to Fronteras, A Changing America. I'm Anthony Moreno. A recent NMSU study shows a big increase in firearm deaths among American youth. Here to share more is a researcher who co-authored the study, Dr. Jagdish Khubchandani, professor of public health sciences at New Mexico State University. Jagdish, it's great to have you back on the program.
Thank you. Thank you for having me.
Now, our country is having a major dialogue on firearms and possible legislation to address firearm violence. What is really the big question that you went after with this study?
So, we hear about gun violence in a week, in a day, or some studies explore them by year, that in year 2010 we had high amount of gun deaths. We wanted to see the changing trends over the last 10 years. We wanted to look at state-wise changes in trends, gender-wise how the gun deaths in children have changed, and get into the deepest root of the issue of how has this problem changed in the last 10 years, nationwide, statewide, age-wise, gender-wise, and what are the methods of death from firearms in young children. And so it was helpful to see, has any change really occurred population-wide, because much of the focus remains on school shooting, but not the children who are dying daily due to guns.
Yeah, a lot of the press and the headlines goes to mass shootings and these horrific events that occur and do occur rather common in recent years. But gun violence is a major issue across the United States. So with this research that you're doing that was published in the American Journal of Medicine Open, what did you really find with these age groups that you were looking at?
So we looked at 0 to 19 years of age. In the last 10 years, there has been a consistent increase in death of children from guns across the nation. And by 2020, guns are now the leading causes of death in children, is a leading cause of death in children. More interestingly, there's more than 3,000 children dying of guns every year, which would equate to 10 children dying of guns daily in the United States in the communities. The vast majority of these children do not die in schools. School shootings kill less than 5% of all children from guns in the United States. So, what happened in Uvalde, Texas recently, 20 people died, children died. We are having a Uvalde, Texas-like situation twice a week nationwide, and we don't have that kind of outrage that we have for a mass shooting, because we have similar number of children dying every week, 10 daily, from guns in the communities.
Now, what was it about the age group that really drew you in to want to understand firearm deaths? What specifically about this age group did you want to learn from?
I think my curiosity was more about suicides, because from 14, 13, when children reach teenage, they have a lot of changes coming in their life, emotional, psychological, physical. And so that was my first curiosity about, is suicide increasing through guns in young children? And then we hear about children playing with guns at home. Is that also becoming an increasing cause of death, accidental shootings, unintentional or unknown cause of death from a gun, and homicides? What is it that kills young children from guns? Is it more of a homicide issue, suicide issue, unintentional, playing at home? So those were a few things I wanted to look at. And also, how are states doing nationwide? What regions do the best in reducing childhood gun death is what I wanted to look at.
Yeah, I found that interesting how you looked at different regions with this research. Very interesting data that you found. Can you kind of share with us what really stood out from the different regions, looking at different regions?
I think we found a region-wise difference from south to west to Midwest to Northeast. And I'm impressed by how Northeast has the least amount of childhood gun deaths. Clearly they are doing something right. We are a part of the same country, but we here in the South and the West have the highest number of gun deaths in children, whereas Northeast has few. And we then have to look at, is it their gun policies? Is it the lower level of poverty? Is it the higher level of education? And those are some questions that need to be explored.
Yeah, some of the research that you found showed that over the past decade, youth firearm deaths increased in the South by 52% and decreased in the Northeast by 28%. Youth firearm suicides also grew by 63% during the same time, and firearm deaths involving female youth grew by 46%. A lot of interesting data that you've came across. One of the things that I noticed you also looked into with this study was other demographic factors. Can you explain what demographics you looked at and why you chose to examine those?
So we went by state, region by region, race delineation of the data, ethnicity, age, and gender. And surprisingly, firearm deaths are increasing both in female children and male children, but females are now catching up with the males. In terms of age, it's the older children. After the age of 12, the gun deaths suddenly increase in children. Region-wise, as you mentioned, South and West are doing very poor. Nationwide, we had a 30% increase in childhood gun deaths in the last 10 years. But South and the West almost have double the rates of exceeding the gun deaths. So we do have these unique groups of Hispanics, white children in the South, in the West, and older that are at high risk of gun deaths nationwide.
Now, also, according to your research, over 25 states saw a jump in youth firearm deaths over the past decade. New Mexico rose by 45%. Some states even a lot higher than that. What was it in New Mexico that stood out with you about this research over the last 10 years? And was there anything that you noticed that we should be paying attention to?
Yeah, I think it's a matter of concern that nationwide gun deaths in children increased by 30%, but in New Mexico by 45%. So at least we would hope to go to the national average and get that much of decline in childhood mortality and death from guns. I think the big problem here is children from low-income households, a lot of poverty around here, border areas, the overall social dysfunction that happens in some parts of the border, and that reflects on childhood crime and neighborhood dysfunction. But thankfully, New Mexico still doesn't have that kind of lax laws that we see in a neighboring state. So we have the potential to do better. We just have to reduce childhood homicides in the state.
Now, you also took a chance to look at what might be happening in states that saw a decline in firearm deaths over the past decade. Was it policy that state lawmakers implemented? Were there some things that stood out from the research that you did by looking at states that saw a decline in firearm deaths? Anything that stood out?
Yeah, we can speculate that states in the Northeast have better mental health care. The poverty rates are lower. Access to guns is not easy. As we move from Northeast to the Midwest and South, we have very easy access to guns, higher gun ownership in households. And I think it's a conglomerate of factors. It's not just one factor. If children are committing suicide using guns, clearly we have an avenue to improve our mental health care systems and reduce access to weapons from those children who are high risk.
Now, obviously, the pandemic has impacted a lot of things, especially when you're talking about mental health. We're seeing more research come out about that. So what are some things that you're curious about right now, knowing that we're trying to come out of this pandemic and the impacts that may have had on mental health, especially on this demographic that you're looking at?
Yeah, and we have, at NMSU, we have published a series of studies from June 2020 to now. I'm tracking the change in mental health status of American people. It does seem like there was an initial huge spike in depression and anxiety, and then it leveled off, it fell down. But now we have a stable pool of additional people with mental health problems. Before the pandemic, 20%, 1 in 5 Americans had a diagnosable mental health problem, and now it could be 1 in 4. So the number of people with depression, anxiety has increased throughout the society. More so with children. When schools are locked down, they have been in isolation, the problems have escalated, and it remains to be seen, are they now more likely to commit suicide or have suicidal thoughts and behaviors? And the latest data suggests that gun deaths are now the leading cause of death in children, and a large proportion is suicidal deaths based on the 2020 CDC data.
Now, with that understanding and concern about seeing these rising rates of depression and anxiety, looking at states that had stronger infrastructure for mental health care, what were some things that maybe those states were doing that other states might want to take a look at?
Yeah, I think in the Northeast you'd see lesser stigma around mental health, more qualified providers. For example, in the state of New Mexico, how many child and adolescent psychiatric providers do we have? And how many of them can communicate in Spanish? So nationwide, less than 10% providers of mental health care are either Hispanic or can communicate in Spanish. The rate remains the same for psychiatrists, psychologists, and most of them don't want to be here in the South and the West because they are getting so many opportunities in the Northeast, higher income, better social life. So we have to improve our recruitment of mental health professionals, see some control of access to weapons, and also create a climate of mental health promotion in the state.
Now, there's going to be this conversation on firearms is going to continue. New Mexico passed, legislation to address this. Were you able to look at what New Mexico did in recent years to address violence with firearms, specifically the so-called red flag laws that lawmakers passed?
So, we have to wait some more time before we get more data through the pandemic, before the pandemic. What happens is we are looking at 3,000 children across the nation, but when you break it down by the state, it's like 50 children. So I would have to need more data for at least 10, 20 years to have a good sample to analyze before and after laws. But it does seem logical, and it has been shown to be effective if properly implemented. Laws like child access prevention laws, where parents are held liable for gun access by children, or red flag laws, seem logical that people are at high risk and you cannot let them have easy access to weapons. And studies show that removal of weapons from high risk people reduces suicide and homicide.
Now, with what we know of the recent mass shootings and killings, there has been instances where the alleged shooter did post things online, showed public signs of possibly committing these acts of violence. What are some things that policymakers also need to consider when it comes to this? We mentioned the red flag laws, but is there anything else?
Yeah, I think if we look at the school shooter profile, according to US Secret Services, most of them are males, teenagers, recently acquired a weapon, have had some behavioral health issues, were known to the school or had connection with the school, and gave a clear threat. This has happened in majority of the cases of school shootings. Now that we have the profile of the school shooter, the one thing that would be helpful is to not have them weapons. So 18-year-olds, 19-year-olds, we don't trust them to smoke or drink or run for the Congress, but how do we trust them to have these weapons is a policy discussion that we need to have. And number two, when we have these kids who have been troubled in school and we know them, there were high-risk signs, the police went to his house once, there has to be better follow-up and maybe refer these people for treatment and find ways to find out these threats and then reduce them in time, because prevention is better than cure. But sadly, our focus goes on school hardening, hospital hardening. It's almost like we know we will have a heart attack and we stock up medication. We don't want to eat healthy and prevent heart attacks. We know the profile of a school shooter. Why can't we stop them? It does seem like we are more concerned with school hardening, as if schools are the problem.
I see. Now, what about adding more security at schools? I mean, was there any data that you found through this, or something that maybe we need to talk about in regards to that folks should be aware of?
So our last study in 2019 that received so much of hype nationwide, if I may say so, we were trying to see, does school hardening prevent a shooting? The answer is no. It can at the best minimize the damage. So the common notion that the hardened schools are better, no, they do not stop a shooter who has made his mind to go and kill people. The most a school security can do is minimize damage, but even with what happened in Texas recently, could we minimize the damage with such school security and hardening? There's always going to be human error. Someone will leave the door open, the police officer will not reach on time, they'll miss the target, accidentally shoot someone. Instead, we go back to the determinants of where this comes from, and that would be more helpful.
Now, another thing that lawmakers are talking about is more comprehensive background checks when it comes to firearm sales, to know who's buying firearms. There is a lot of concern, though, about private firearm sales and how those can fall under the radar. Some communities do implement these laws to permit to really keep updated and keep law enforcement updated on who's purchasing these. Can you kind of share with us what you were able to discover with this?
Yeah, so having laws does help. Now, how strongly are they implemented is a question, and then we have these loopholes of gun fairs and private sales. But still, if we look at our nation and divide by regions, where do we have the most firearm deaths? That would tell us where the policies are actually working some. And policy alone is not a solution. So, yeah, background checks, extreme risk protection orders, red flag laws, child access prevention laws are the things that we have to explore, sadly, because we have more guns in the country now than people. And the horse is out of the barn, and we are just trying to find some band-aid somewhere to reduce the problem. We'll never get back to having a total decline, but we'll maybe achieve a stable level of gun violence as an American endemic across the years now.
Now, I mean, you pointed to regions of the country that are really having troubles with this, and that there may be certain laws in place to address firearms or not address them at all. What were you able to find with the difference between these regions that had the highest number of firearm deaths over the last decade for youth? What predominantly stood out with their laws in regards to firearms?
So I think that the laws just don't really relate to firearms only. It's beyond that. States that have expanded their mental health care are seeing lesser suicides and lesser number of death of people. States that have rigorous firearm policies have lesser ownership, lesser number of suicides and homicides. So it's really a package of policies for improving mental health care, reducing weapon access for high-risk people, that has led to Northeast doing so much better than the rest of the country.
With that, though, in mind, I mean, there's a lot of things that we have to consider with this. It seems like a lot of things are running parallel with understanding mental health and firearm laws and how they're correlated.
Right.
So, I mean, moving forward, what sort of interests you with the research that you want to look at moving forward when we know we're finding out these two things?
Some days I have to admit to myself that I probably know the answer, but I still have to research. Not that I want to bias myself, but we are not doing anything to prevent the epidemic now. Gun sales have broken all the records, as you know, in the past 2 years. We have more guns than people in the country. Mental health has worsened. So I'm just looking for some ray of hope on what policies, procedures can help reduce the epidemic of gun violence. But my guess is that it would escalate now. Given the trends from 2019, 2020, 21, our gun deaths would increase nationwide. Now we are at 45,000. Maybe next year it would be slightly higher. But interestingly, most gun deaths in the United States are still by suicide. And that I see as a huge avenue for prevention by laws and policies, improving healthcare, like simple things in New Mexico. What if we had more Hispanic, Spanish-speaking mental health providers? And so it's about building a foundation, looking at long-term and also short-term on how do we reduce suicide in the short term.
How does poverty intersect with all of this?
Yeah, and poverty does intersect. If someone has no income and they need mental health care, what would they use as a source of help? Family, friends, religious leaders. So states that have expanded mental health care or have probably expanded Affordable Care Act, Obamacare, taken the money to improve their mental health should see some benefit.
Over the pandemic, we learned that remote mental health treatment was something that people were relying on. Is the infrastructure in place in New Mexico to really make that happen?
I don't think so that we have what I would desire, but we still did well, given that we came with a lot of disadvantage. Before the pandemic, we were in the bottom 5 in healthcare, poverty, college graduation rates, homicide, and suicide. Despite that, I think New Mexico has invested a lot in mental health, and they should sustain the momentum so that we are not in the bottom 5 for suicides and homicides and poor mental health, and at least we can be close to the national average.
How much of this does education make an impact on in regards to possible mental health and depression and the things that you mentioned through research are showing a correlation with firearm deaths? Does education play a role?
Yeah, huge. Education, formal education. The more education you have, the less likely you are to die by suicide or have mental health issues. It's also correlated with having a college degree, that you get a job and insurance, you're able to pay. And beyond that, I think informal education, being aware, creates a sense of mental health promotion in communities. Communities that have lower education, lower access to healthcare, and then there's a huge stigma around mental health care. If you take a national sample of American people and ask them about what would they do if they knew someone was suicidal, they'll give you all types of answers depending on their education.
What about drugs and the people who may be addicted to drugs and how that may impact behavioral health in our region? New Mexico, obviously, there's some data about how much the opioid epidemic has impacted our state. Any correlation with drug addiction and firearm deaths?
Yeah, and so we have lumped up mental health problems and drug use as one. Historically, there was a time when we thought they were two different entities, but now federal government, global agencies have put them together, mental health issues and substance use disorders. So substance use is a mental health issue, and there is a strong correlation. For example, studies now in the Midwest show that they have dual crisis, opioids and guns, both at the same time in a certain high-risk population.
With that certain high-risk population, what are we talking about? Can you share with us, what is the high-risk population for that?
So it's clearly males for the most part, a lot of males of color with lower education and have a profound amount of social neighborhood dysfunction, live in high crime areas where there's a lot of drug activity, gangs, and that I describe as high risk.
Okay. Now, as we move forward and look at research regarding this, we're getting more information about what the CDC is releasing, looking into firearm deaths. What are some things that are catching your eye as we look forward with our research, on this?
I think I get surprised sometimes with the fact that when we were in the lockdown phase, I assumed there would be lesser deaths in children from guns or lesser number of suicides. Families would come together, which some countries have shown that their suicides have declined. But paradoxically, in parts of United States, the suicide rates were much higher in the pandemic lockdown phase, and homicides increased as well. Crime in big cities increased.
Now, with the rise in youth firearm deaths, I mean, you talked so much in depth about the mental health aspect, about how this may be playing a role, but what about just having access to a firearm as a kid? I mean, what do we know with that? I mean, there has to be some grave concerns about our adults keeping firearms away from children.
Yeah, and that's why we have the child access prevention laws in many states, where parents are held liable if the child is using a gun or has access to gun. We saw the Michigan story recently. The child acquired guns from the parents and started shooting. And I believe there should be liability for parents if a child is able to access their weapon and kill himself or someone or herself or someone else. And those laws have shown promise now. We are still trying to know more about these laws. Like in our recent study that we are trying to finish here, we are comparing states with the law, without the law, and look at firearm homicides and suicides in young children.
Now, what about data with folks who are gun users and feel very strong about how guns are a part of their culture? It may be a firearm may be passed down through generations and have a certain social and family significance to somebody. What are you learning from the research, or are you looking into the cultural impact that guns are having in our country?
Yeah, I think culture is a huge part. As an immigrant, I can appreciate it more day by day. And that's one thing that I've made clear, that I never talk about taking away guns or gun control. For me, it's more about gun reform. And I know people feel strongly about it. Many of the elderly who have guns today were given the guns from parents, grandparents, or they bought it in youth. So that's one part that I'm always aware of, mindful about. And the second is, I think the people on the left and the right, policymakers, get into too many extremes, whereas the public has a better sense of what we need. Majority want background checks and tougher gun laws, but I think the left and right in the country go into the extremes and cause more chaos at times. But gun owners have to realize that having a gun in the household increases your chance of death by suicide, homicide, many, many more times.
Now, we just have about 20 seconds left,
Okay.
but so much attention is focused on mass shootings, mass killings, but everyday gun violence. What are some of the things that you've looked at on how we could better shine light on those issues that are happening every day in our communities?
Yeah, I think mass shootings are distressful. A lot of children are killed at the same time and they seem vulnerable. The media plays into it. The parents are concerned. They force the policymakers. The policymakers will then do something right away, throw some more money. We have to get away from that culture and look at it comprehensively. Why are 10 children dying of guns daily in the United States? We have a Uvalde happening every second day in this country.
Dr. Jagdish Khubchandani,
you.
thank you so much for joining us on Fronteras at Changing America.
Thank you.
And we want to thank you for joining us for another episode of Fronteras. Remember, you can always view past episodes of this program at our website, krwg.org. I'm Anthony Moreno. We'll see you next time.